Okay, a person's cup disc ratio, we're going to talk quite a bit more about this, maybe zero point 0.7, and it really is 0.7. That's valid, but it's irrelevant. Who cares? A cup disc ratio, 0.7, can occur in a person who has glaucoma or doesn't have glaucoma. It's irrelevant to whether they've got glaucoma or not. So what difference does it make whether it's 0.7? Visual fields, I'm going to talk about these three things. Visual fields, disc and angle evaluations are often not valid. The level intraocular pressure and the amount of field loss are often not relevant to a patient's quality of life. And the level intraocular pressure and the development of the field are often not important to a patient. And I'll talk to you about some patients in that regard. So here we go. Regarding validity of field examinations, in the Oates study, you probably know that after the study had started, one of the investigators said, I wonder if we're making determinations that the person is converted from no field loss to field loss on the basis of one field. I think maybe we ought to get a second confirmatory field. They found that 88% of their first visual field examinations were wrong. Then if you look at the three randomized controlled studies that looked at fields, the study that Anders Heil did in Sweden, the AGES study, and the CIGST study, they all used very different methods of determining whether fields were normal or abnormal. 92% of those methods, the fields, they didn't agree. Patients' ages were the principal investigators at the start said, well, if we're trying to recruit the patients, and if they've got a notch, we know they got glaucoma. So, well, they couldn't agree on what was a notch. I did a study in which one of my fellows looked at patients longitudinally with DDLS. It was clear after we looked back, he had no idea how to look at the discs. They were trash. The DDLS were all inaccurate. When Paul Lichter did a study on disc photographs, he found that Doug Anderson, me, Bruce Shields, a bunch of glaucoma experts couldn't agree whether disc photographs showed glaucoma or not. Manjul Shah showed that 50% of gonioscopic examinations missed the fact that the angle was going to close. So much of what we think is, on the chart is just trash, but we pay attention to it. But it's trash. It's not valid. We shouldn't pay attention to invalid information. Now, is it relevant? Okay. We started right off saying what's important to a person is how do they feel and how do they function. Quality of life is important. But is intraocular pressure relevant to that? A person can have a pressure of 20 and lose no vision, or they can go blind. So it's not 20. The fact that the pressure is 20 is irrelevant to that person's well-being. Now, furthermore, we measure the pressure when the patient's in the office, but 95% of the time, we don't have any idea what their pressures are. We just generalize for that one pressure in the office, and we think, oh, that's what it is the rest of the time. We know that's not correct. Every time they're blinked, their pressure changes. When they put their head into a pillow, their pressure changes. But still, we think, oh, that pressure is 20. That's really relevant for that patient. Bull crap. Now, how about visual field loss and ability to perform vision-related? Well, Rohit Varma shows us a straight line showing that good fields, you can do everything, bad fields, you can't do anything. Well, this is the reality. He eliminated all the outliers. This is what it really looks like. Here's visual field. Here's the ability to perform activities of daily living. And what you can see is here's a person up here who's got a terrible field, who can do almost everything. This means you can do everything of these 9 tests. This means you can't do any. Down here is a terrible field, and over here's a good field. But here's a person up here with a bad field, and they can do almost everything. Here's a person with exactly the same amount of field loss who can't do much at all. Here's a person who can do half the tasks, got a terrible field. Here's a person with a great field who can't do anything any better than this person over here with a terrible field. Of course, there's a relationship, but the scatter is huge. We think in terms of straight lines, but that's not the real world. We see this person here who's got a terrible field, who's functioning very well. We have to figure out, why is that person functioning well? How can I help him? Here's this person down here with the same field. Why is this person having trouble? Importance. I'm just going to skip right down here to this. Blindness is not important to some people. I remember fairly early in my career, I was taking care of a Catholic sister. And it was obvious she had glaucoma. She came because she was about 30 years old and she was having trouble reading. She was a teacher and she thought maybe she should see somebody. So she saw an optometrist, and the optometrist said, I think you have glaucoma, you better see somebody. So she came to see me. Indeed, she had high pressures. She had thin disc rims. She had a lot of field loss already. And I told her, yes, you have glaucoma. You have what's called juvenile onset open angle glaucoma. Sometimes it responds to treatment, but sometimes it doesn't. But there's good surgery for it. So you're still seeing okay, and the likelihood is you're going to continue to do well. And I think, but we'll start you on some medicines. That was before laser was available. We'll start you on some medicines. And she said, oh, I can't use medicines. I said, why not? She said, oh, no, Jesus wouldn't want me to use medicines. Jesus will take care of me. And I said, well, I think Jesus would want you to continue to be a teacher. It sounds to me as though you're a pretty good teacher, but it's going to be hard to do that if you lose your sight. Oh, no, Jesus will take care of me. Well, she wouldn't use the medicines. I said, well, why don't you come back and see me in 6 months? We'll talk about it more then. So she came back in 6 months, and she lost some more vision. And her field was maybe about the same, and maybe a little worse, but she thought she was a little worse. And so I went through the whole thing again. I said, you know, you recognize, you tell me you're having more trouble. That's going to keep going. Well, she said, oh, no, I'll be okay. Well, she came back in 6 months. She continued to come back every 6 months until she was totally blind, no light perception in both eyes. And when she got to the point where she was really having trouble seeing, was the first time I realized that she thought she was an instrument in God's hands to try to prove to her students that external sight didn't matter. That what mattered was whether you were kind, whether you were loving, whether you helped people. That's what mattered. And sight didn't matter. Was she right? She was right for herself. What matters to some people doesn't matter to others.